Hi, I'm Angela Pifer, creator of the Clean and Lean Revolution. I see a lot of patients with digestive complaints, some with heartburn, others with bloating and indigestion, and still others dealing with chronic constipation or loose stool. Insufficient stomach acid production is an often overlooked condition in many people complaining of digestive issues. Instead of finding the root cause, symptoms are addressed with a Band-Aid treatment. If you have heartburn, you're prescribed an antacid, which further lowers your stomach acid levels. If you have IBS, this is treated with fiber, laxatives, and sometimes an antidepressant. If you have SIBO, you're treated with an antibiotic. If you have a food sensitivity, you're told to remove this food, but none of these Band-Aids fix the root cause of the issue. If we look at each of these symptoms and conditions, most of these cases have something in common, and that's low stomach acid. Heartburn is often caused by low stomach acidity. I know this sounds counterintuitive, but here's why. If you're not producing sufficient stomach acid, then you won't digest your food at a quick enough clip. You need to have adequate stomach acidity to signal the sphincter to close between your stomach and your esophagus. If you don't have the right stomach pH, then the sphincter won't close, and this will allow stomach contents to back up into the esophagus, causing heartburn. Without sufficient stomach acids, food will not digest well enough. You won't be able to break down the food to the degree that you can access enough nutrients. This sends intact pieces of food into your digestive tract, which can lead to food sensitivities. So yes, removing a known food allergen is a good idea, but if the underlying condition is not treated, you'll likely become sensitive or allergic to another food. If you aren't digesting your foods well enough in your stomach, undigested carbohydrates can be fermented by gut flora, causing bloating, cramping, and sometimes diarrhea, and sometimes constipation, leading to IBS. Stomach acids, along with bile acids, keep the flora in check at the beginning of the small intestine. When stomach acid is too low, this allows larger levels of flora and other organisms to take up residency in the upper small intestine, leading to SIBO, a small intestinal bacterial overgrowth. Low stomach acid production has been directly linked to metabolic conditions and even rheumatoid arthritis. When intact pieces of food pass into the bloodstream and settle in the joints, the immune system can respond by attacking the area around the joints. So why do some people produce too little stomach acid? Low stomach acid is linked to hypothyroidism, autoimmune disorders, the use of antacids or proton pump inhibitors, stress, H. pylori, post-cancer treatment that includes radiation, and it's linked to gastritis, gut inflammation. If you've had gastric bypass, you will definitely be at risk. And if you have a nutritional deficiency of niacin, zinc, or iodine, this will all affect stomach acid production. So let's get back to talking about the implications of not being able to digest your food. One question I ask in the intake session is, do you see any intact pieces of food in your stool? This often gets the reply, no, only corn. And on other occasions, the patients will reply, yes, often. Intact pieces of food in your stool, yes, corn, or anything else, is a serious symptom. Food is making it through every stage of digestion undigested. This may mean that you aren't chewing well enough, you aren't producing enough stomach acid or digestive enzymes, and it may mean all of these, and that there's inflammation or even dysbiosis present, an imbalance in gut flora. And it may mean something more serious. As a nutrition detective, it's my job to figure out where the system is breaking down and to help you bring it back into balance. One of the things that we assess is whether or not you're producing enough stomach acids, and whether you may need supplementation or support to produce sufficient stomach acids. A hydrochloric acid or HCl supplement is an option. When you take the supplement, you aren't taking enough to change the pH of your stomach. You're simply taking a very small dose that will help to digest the food that it's taken with. It's been shown in studies that taking HCl does not suppress your body's ability to make HCl, which is a good thing because we definitely don't want to override your body's ability to produce HCl naturally. So when is HCl not a good idea? If you have gastritis or an ulcer or a history of these, HCl is going to be contraindicated. You should always take HCl under the care of a qualified practitioner. Please don't rush out and get this supplement. Another option is to take bitters. Bitter herbs help to stimulate the stomach to produce more acid. Bitter melon or gentian tea are two widely used bitters. Herbs are also bitters. I always recommend that at least one fresh herb is added to each meal, whether cilantro to a wrap, basil to a salad, or chives and parsley to a stir fry. The bitterness sends a signal to the brain to get the whole digestive tract, the liver, the pancreas, and the intestines, on the lookout for incoming food. One contributing factor to the epidemic issues that we are seeing with digestion is because we have bred the bitter out of food. But this is a topic for another video.